Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. So today, I'm going to explain you about a new topic, about a new disease that is malaria. So let's begin with the topic. So I think it is visible on your screens. Either you are using the mobile phones or the laptop screen. So first of all is the definition related with the malaria. So malaria is one of the major diseases of the country, and it is also present over the various countries of the world. And there are lakhs of cases that are found each year in different countries. So India, in which the health system is not strengthened in its own way, I would say. So this disease is causing severe problems to the population in the matters related with the health. So due to this reason, this is one of the major health problems of India. So first of all, let's start with the definition. Malaria is a communicable disease caused by infection with the protozoal parasites of the genus Plasmodium and transmitted to man by infected female Anopheles mosquito. Okay, Anopheles mosquito is the vector. Okay, so it is a communicable disease that can transmit from uh, that is a protozoal disease, and it is caused by the causative organism that is of the category of the plasmodium, and it is transmitted through the vector. Sometimes the external examiner may ask that what is the causative organism of the malaria. That the answer would be it will be the Plasmodium vivax, Plasmodium falciparum, Plasmodium aviari. But if he or she is asking about the what is the vector of malaria, then you have to answer that female Anopheles mosquito. So that is the difference. So as the BSc nursing and post-basic nursing exams are uh, being are continued, so uh, so the practicals are coming within few days. So that can be a question that might be asked in the external exams. So just note it down. So let's move on. It is then characterized by three stages. So in the malaria, there are three stages, clinical stages, I would say. First is the cold stage, second one is the hot stage, and third one is the sweating stage. So cold stage, hot stage, and sweating stage. So I will explain you about these stages in a later. Uh, Next is the febrile episodes occur with definite intermittent periodicity repeating over third or fourth day, depending upon the species of the parasite. So clinical features and the other symptoms of the clinical signs that depends upon the type of the parasite that is affecting the body of a specific person. Okay, so that was about the definition. So in today's lecture, I will complete the part one, and in second lecture, I will complete the part two of the malaria. So that is a big disease. So I will explain this disease in two parts. Okay. So today I'm connecting with the uh, first part, that is malaria part one. So next is the problem statement and the magnitude of this problem. What is the magnitude of this problem at world level? So here are some of the statistics. That is, malaria is a global problem, killing about 1.4 million people every year. So that is a average statistics of the death rate, I would say, at the world level. So globally, about 1.4 million. That is near about 10 lakh 40,000 people every year are killed by this type of disease, mostly under 5 children, and more than 2.4 billion of the world's population is at risk of malaria. So that is a huge amount of huge population that is at the risk. So that is the reason why this disease is being regarded as one of the major health problems of India as well as of the world. Okay. So next is malaria is a major problem in sub-Saharan Africa caused by Plasmodium falciparum, and other regions affected are Southeast Asia region and East Mediterranean, where it causes significant mortality and morbidity. So basically, the southeast or the sub-Saharan Africa, that is mainly affected by this type of disease. Other countries or the continents are like the Southeast Asia, in which India is also included. So that is the a country with the number of cases. Okay. Next is instead, like in 2010, there were estimated 260 million cases of malaria worldwide. So that is a huge amount, huge number of cases. That is the morbidity rate, and specific mortality rate for malaria was 19.8 per lakh population worldwide. So that is the uh, some of the recordings, I would say, related to the malaria at the world level. Next, moving on at the India level. So in 1977, India implemented modified plan of operation, due to which the number of malaria cases dropped down from 6.7.4 million in 1976 to 2.1 million in 1984. So uh, let me tell you that in 1953, uh, the Indian government launched a program that was a national program related to the malaria, and in 1958, it was renamed as a national malaria eradication program. Okay, and after that, the urban malaria scheme and lots of other programs related to the malaria were implemented by the Indian government. So, as per this data, there were 6.74 million cases in 1976 that were 2.1 million. So this shows that this policy was working as the cases decreased from 6.74 million to 2.1 million. Okay, so that is about the data according to the Indian government or the Indian settings. Okay, and about 27% population lives in malaria high transmission. So out of the total population of the India, the 27% population lives in the malaria in the areas with malaria high malaria transmission, uh, or where the risk of malaria is high, and about 58% in low transmission. Okay. Next is some of the facts about malaria in India, and these are given below. What are these facts? There is a decreased trend in the annual incidence in the country from 3.29 in 1995 to 1.10 in 2011. So, according to this data, the cases of the malaria, or the morbidity rate due to malaria, is decreased up to some extent uh, in India. Okay, so this is one fact. Second is during 2005, about 1.8 million cases were reported with 963 deaths, and in 2011, a total of 1.3 million cases and 463 deaths were reported due to malaria. That is also a good thing. And next is malaria is a serious health problem in northeastern states due to its topography and climatic conditions, which are congenial for the malaria transmission and its prevalence and breeding of the Anopheles mosquito. So, why malaria is affecting a number of states in India, or as a whole, India is affected by the malaria disease? Because the problem in India is overpopulation, and due to overpopulation, there is a second problem, that is maintenance of the sanitation. And this is the disease that is uh, 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 of which the main causes of this disease is the stagnant water or the poor sanitation. So that is also a major problem for the India, and also a causative, major causative factor for malaria. So these are interrelated factors. So that this is the reason why the malarial cases are very high in India. Next is Assam reports maximum number of malaria cases, including Plasmodium falciparum. Okay, so that is a report. Next is major endemic areas in India: northeastern states, Andhra Pradesh, Chhattisgarh, Gujarat, Jharkhand, Madhya Pradesh, Maharashtra, Rajasthan, Odisha, West Bengal, and Karnataka. So these are the some of the states that are affected by this disease, uh, uh, or where the cases are high. And much of these areas are remote forests and inhabited by the tribal population. Okay. Next is there is low transmission of malaria, which is seasonal with increased intensity related to the rains in India. So this is the disease in India. This disease have a pattern like when there is a rainy season, the cases of this disease are increased every year. So the government has to take various type of precautions or the preventive measures against the causation of this disease, that to decrease the number of the cases related to the malaria in the rainy season. Next is urban malaria cases are reported from major metropolitan cities due to the poor environmental sanitation, slums, and poverty. And also, in the metropolitan cities, like the major cities in India, uh, these a number of cases are reported from these cities because there are some areas in these, I would say, the uh, cities, metro cities, in which there is overpopulation and there is presence of the slums and poverty. So this is also the reason why these cases are on high in the metropolitan cities. Next is epidemiological factors. So what are the various factors that cause this disease? First are the agent factors. So what is the agent and what are the factors related to it? First is the agent. Agent causing malaria is malarial parasite, as already I have explained. It has four distinct species, that is Plasmodium malariae, Plasmodium avele, Plasmodium falciparum, and Plasmodium vivax. So, of which the Plasmodium vivax and Plasmodium falciparum are the most common causes of the type of the agent that's causing this disease. Plasmodium vivax infections are the most common and have the widest geographical distribution, as I have already explained. In India, about 50% of the infections are due to Plasmodium falciparum. So, if anybody's or any external examiner is asking you that what is the commonest causative organism for the malaria, that is Plasmodium vivax, and after that, Plasmodium falciparum is the second, is at the rank second, that is causing most 50% of the total, I would say, the uh, total number of cases, and 4 to 8% due to mixed infections, and remaining due to Plasmodium, sorry, uh, due to the Plasmodium vivax. Plasmodium malariae causes less than 1% of the infections in India. Okay. Next is life history. So before that, I will explain you about the reservoir of the infection. So what is the reservoir of the infection? That is the common, I would say, from which this disease is transmitting to the persons. Reservoir of infection is human being which carries the sexual forms of the parasite. Those act as the reservoir for this disease, and a patient can be carrier of many plasmodial species. The humans itself are the reservoir for the infection, and a patient can be carrier or case. Next is source of infection. So what is the source? Is a person who harbors both the sexes of the gametocytes is the source, and otherwise further development cannot take place in the mosquito vector. Man itself is also a source of the reservoir. And next is the period of communicability. Period of communicability is as long as there are mature, viable gametocytes existing in the circulating blood of the reservoir in sufficient numbers. Otherwise, mosquitoes cannot be affected. So the mosquitoes are affected by the affected humans, and uh, they are communicated to the another person through the mosquitoes. Next is host factors. So these were the agent factors. Next is the host factor. What are the various host factors? First is age. So no age bar from this, but newborns are not affected with Plasmodium falciparum. So there is no age bar. Any person of any age can get infection of the malaria, and because the newborns, these are not the newborns are not affected by the Plasmodium falciparum because they have a high level of HP, which suppresses the development of Plasmodium falciparum. Okay. Next is the sex or the gender. Males are more frequently affected than the females. Next is the pregnancy. So pregnancies, it increases the risk of malaria in women. So due to if there is the woman is pregnant, then there are the chances that he or she can get the infection of malaria. Okay. Next is the socio-economic development. Malaria has disappeared from most of the developed countries because of the better living facilities and good environmental sanitation. That is the exact point or the cause that I was talking about. That the main factor is good environmental sanitation is required. Okay, so environmental sanitation is must if you want to suppress the cases or you want to prevent the cases of the malaria. And many of the developed countries where this condition has been achieved by that country, so malaria has totally disappeared from that country. Next is housing. Good housing with well ventilated lighting and good sanitation facilities do not give shelter to the mosquito. So this is a health education that good housing conditions, like the house must be made of the cement, or it should be, we can say that the well ventilated lighting should be proper, good sanitation must be maintained. Okay, so all these factors will prevent the cases of malaria. Next is population mobility. Causes importation of the malaria parasite in the blood of the migrants in areas which are free from malaria. So when there is a migration of the population from one area to the another, this might bring the many number of cases, a more number of cases, or the number of cases to that location of the population in which this disease was not occurring, uh, was not there before the migration. Okay, so migration or of the population, one population to the another population, can make the another population at the risk, which was totally free from that type of infection. Next is about the occupation. That can also be a host factor. It includes agriculture practices are related to malaria because farmers are exposed to mosquitoes in the fields and have more chances of being bitten. So farmers, the main occupation of the farmers, they are totally at the risk. So farmers should, I will suggest the farmers that they should cover their whole body while they are working in the field, and so that they should be prevented by the infection of malaria. Okay. So next is about the environmental factors. That was about the host factors. Next is about the environmental factors. So the total thing is depending upon the of the malaria is depending upon the environmental factors. Okay. So first of all is the season. When there is rainy season, so this will give a boost to the infection, or the number of cases will increase. Malaria occurs mostly from July to November in most parts of India when there is a high humidity and sustainable temperature. Second is temperature. Favorable temperature for the development of malaria parasite in the mosquito vector is 20 to 30 degrees centigrade. So that is the exact temperature that is required for the malaria mosquito, so to transmit the infection. Okay. Next is humidity. Relative humidity of 60% is favorable for the mosquito to live its lifespan. And altitude. Altitude above 2,000 to 2,500 meters is unfavorable for Anopheles mosquito. Last is man-made malaria. Man-made malaria. Construction of the irrigation channels. This also brings the number of the cases because the dams, roofs, garden pools, in some of the sources where the water is stagnant, that can act as a source for the malaria cases, or the for the breeding places of the malaria. Like we are having the ponds, in which there is a water filled ponds in different villages. So the water is stagnant, and that can act as a breeding place for the case for the mosquito that will transmit the malaria. So all the villages should or must use preventive techniques. So the some of the techniques that can manage the water that is stagnant water. Okay. So that was about the environmental factors. Next is about the mode of transmission. So what are the various modes by which this infection can transmit from the mosquito, or it is caused to the specific host? Next, first is the vector transmission by the bite of certain species of the infected female Anopheles mosquito. So this is the first, that is vector transmission. It is type of we can say that uh, indirect transmission. Okay. Next, second is uh, direct transmission by intradermal, intramuscular injections using infected syringes and needles, or intravenous injections of the infected blood or plasma. Okay, so by the vector transmission, it is by the bite of the mosquito, and secondly, it is through the use of the infected syringes, that the injection must be given through either the intramuscular or intradermal or any other route of administration. So that can cause the direct transmission of infection. Next is congenital malaria. Malaria can be transmitted from an infected mother to its newborn, but it is rare. So it can be caused, but the total number of cases are rare. Okay. Next is the incubation period. So that is an important question that is asked in Viva uh, by the different external examiners. So what is the incubation period of the causative organism of the malaria? So it is different for the different type of species. Like first is Plasmodium vivax, it is 14 days. Plasmodium malaria, it is 28 days. Plasmodium falciparum, it is 12 days. And Plasmodium avale, it is 17 days. Okay, so Plasmodium vivax 14, malaria 28, falciparum 12, and ovale is 17. So that was all about the incubation period. Next is about the clinical features. Okay, so next is about the clinical features. What are the various clinical features if a person is infected from the malarial parasite? So what different types of clinical features he or she must show when the infection is prominent? So it is divided according to the stages, categorized under the different stages. First is the cold stage, is marked by the temperature rises rapidly to 39 to 41 degrees centigrade with rigors which last for 10 to 15 minutes. Headache is present. So that is the basic sign. Headache with fever and chills. So headache is often severe and common. Commonly there is nausea and vomiting and skin is cold. Okay. So skin becomes cold, headache is present severely, and pulse is rapid and peak, and parasite can be seen in the blood. Okay, so this is about the cold stage. So we can diagnose the parasite in the blood by the use of the blood test. We can find out, or the confirmatory test can be performed, and this stage lasts for about half half to 1 hour. Next is hot stage. Patient feels burning hot, and headache is intense but nausea diminishes, and pulse is full and respiration is rapid. Respiration becomes rapid, and the body of the person becomes hot. He feels like he's burning, or the body becomes hot, totally hot. So this stage lasts for about 2 to 6 hours. Next is sweating stage, and that is the third and the last stage of the clinical feature. That is, fever comes down rapidly with profuse sweating, and skin becomes cool and moist, and pulse rate is slower, and the patient feels better and often falls asleep due to exhaustion. So this is the condition when there is the feeling of the exhaustion, like the body is exhausted due to the first and the second stage, and this stage lasts for about 2 to 4 hours. Okay, and febrile paroxysm occurs intermittently after 48 in Plasmodium vivax infections and Plasmodium falciparum infections, whereas in Plasmodium malaria, fever occurs after 72 hours. So these are the clinical features of this disease of malaria, and it is divided into 3 stages. That is the first is the cold stage, second is the hot, and third is the sweating stage. And so there is a time period. That first stage, that the duration is half to 1 hour, second is 2 to 6 hours, and next is 2 to 4 hours. Okay. So that is very important for the theoretical as well as viva point of view. Okay, so that was about the clinical features. Next is about the complications and other things. So these I will complete in the second part, that I will explain you in the next week. Okay, so I have completed the first part of this disease, that's malaria. In today's lecture I have explained you about the definition, okay, and the magnitude of this disease, the modes of transmission, and the epidemiological factors like the host factors, agent factors, and the environmental factors about this disease, and the incubation period of this disease, and the clinical features. Okay, so rest of the topic I will explain under the part 2, and that I will explain in the next week. So thanks for being with me. Thank you very much, everyone, and I will uh, again discuss with you about this topic in the next week. Okay, thank you very much. Thank you.